My name is Benjamin Walton. I've been a practicing physician at LENS for 10 years. I initially joined the group out of my residency in 2015. 3 ENT groups, including my practice, merged into one to form LENS. We initially merged the 3 groups and found that merging practices was cost prohibitive, and if we wanted to try to make a regional ENT practice, that the cost and time effort would not necessarily allow us to get the benefit we thought. Therefore, when we looked for different options, we found that Elevate had a very mature MSO with a lot of different practices involved, offering many of the things that we were looking for as we had initially made that merger. We noticed that in our practice, where we were at, it was difficult for us to get supplies, and that became a challenge through COVID. Some of the other issues we ran into was our contracts, our tax ID issues from merging 3 practices that were already going to be headaches. After the Elevate acquisition, our group was able to obtain a number of significant benefits. One of the benefits including switching over to a new EHR. This has helped us to really clean up our RCM process, which has allowed us also to get a lot of data that has helped us to better manage our practice, understand where we can be more productive as physicians. We also saw a significant benefit from the cost of supplies, both in the office and through our ancillaries. In particular, our hearing aids were able to see a big improvement in the overall price, which allowed us to improve that ancillary and concentrate on optimizing our stance in our practice. Finally, Elevate has also allowed us to improve our ability to find the right talent for our offices. It has helped us to understand where we may be overstaffed or understaffed in our offices and how to best optimize our practice that way. The main focus from the Elevate team was not to change how we treated patients. They look at how we schedule patients, how we run our day-to-day, and can offer advice, but not mandate or tell us how to run our practice. Having the large number of physicians and the data and the experience of so many other doctors around us in this group has helped us to understand where we can maybe do things better, but also where maybe we're doing things the right way. One of the benefits of being a part of Elevate is this is a physician-led MSO. We are still an independent practice. We're still practicing medicine the way we did before. However, now we have the framework and the backing of qualified people to help us make decisions. We understand that we have people from all over our MSO now where we can find the most qualified people to help us make these decisions. We're still patient first, physician focused. We want to make sure that we have the ability to run our practice the way we did before we joined the merger and acquisition, but have the ability to improve our practice and be more productive and better physicians in the long run.